evening. Please, today we are doing diabetes. We are moving to the endocrine disorders. We're going to do diabetes today. So when we say diabetes simple means high level of what? Sugar in the blood. We just have to know the pathophysiology, what happens in diabetes. So we first have to think about the pancreas. If they say diabetes, what should come to your mind is the pancreas. In this pancreas, we have the beta cells of the pancreas, and we have the alpha cells of the pancreas. The beta cells of the pancreas is what produces a hormone called insulin. And then the alpha cells of the pancreas produces a hormone called glucagon. So in diabetes, we have insulin and then glucagon. Whatever that you eat in your body, it is converted to glucose. And then this insulin serves as a carrier vehicle that will carry the glucose into cells that needed this glucose. So if you happen not to have enough insulin or deficiency of insulin, or the insulin is not produced at all, you are going to have diabetes. Because what it means is that you can have a lot of sugar in your body, but there's nothing like insulin. That is a hormone that is going to carry the glucose to where it is needed in the body. And that same insulin carried that glucose to the liver. And that glucose is stored in the liver in a form of glycogen. Excess glucose is stored in the liver in a form of glycogen. So when your body needs glucose, this excess glucose stored in the liver will be reconverted back to glucose. And in the process of that conversion, we call it glucogenolysis. Glucogenolysis. The process of reconverting the glycogen, that is the stored glucose in the liver, back into glucose to be utilized by the body is glucogenolysis. Under the influence of glucagon, that is a hormone produced by the alpha cells of the pancreas. So now we have types of diabetes. We have type 1 diabetes and we have type 2 diabetes. Type 1 diabetes is also known as juvenile diabetes. It is usually associated it's mostly common in children. With this, there is an autoimmune disease that destroys the beta cells of the pancreas. And for that matter, insulin will not be able to produce. And if insulin is not produced, you have diabetes. You can have hyperglycemia, you can have high level of glucose in your blood, but there's no insulin to transport this glucose to the body cells. That is type 1 diabetes. And it is insulin dependent diabetes. Those who are having type 1 diabetes is going to remain in insulin for their whole life. Their life depends on insulin. They are going to be giving them insulin injection for the whole life. And we also have type 2 diabetes. Type 2 diabetes is an insulin dependent diabetes. It is usually associated with high cholesterol levels and then obesity. In this type of diabetes, we have hyperinsulinemia as a compensatory mechanism. There is excess production of insulin, but the insulin cannot be used by the body because the body is resistant, the body cells is resistant to the insulin. So the pancreas compensates that by producing excess insulin, that is hyperinsulinemia. With time, this pancreas will get tired and will also slow down the production of this insulin. So the diabetes that you get from this mechanism is what we term as type 2 diabetes. It is usually associated with high cholesterol levels and obesity. And this one is an insulin-dependent diabetes. So this one can be controlled by lifestyle modifications. So now, signs and symptoms of diabetes. From the pathophysiology, we get to realize that there will be high level of what? Glucose in the blood. That is hyperglycemia. If there is high level of glucose in the blood, what do you think will happen? We'll have glucosuria. We'll have glucose in urine. If you have glucose in urine, and the main function of the glucose for the body is to provide the body with energy. So that means that you are equally going to have fatigue as part of the signs and symptoms. You are going to have polyuria, excessive urination, that is polyuria. You are equally going to have, if you are urinating more, you are going to have dehydration because you are losing more fluid. Polydipsia, because the body will want to compensate by increasing taste. So you feel excessive taste. That is polydipsia. You can equally have polyphagia, increased appetite because of the proteolysis. Proteolysis is just talking about the breakdown of protein. So if the protein has been broken down, what it means is that there is increased energy expenditure by the body. And if there is an increased energy expenditure by the body, what it means is that we are going to have high metabolic rate. And if we have high metabolic rate, what it means is that you're going to have protein wasting. And this is going to translate into polydipsia, that is increased appetite. So increased appetite is also another sign and symptoms of diabetes mellitus. You are equally going to have poor wound healing. So these are some of the signs and symptoms of diabetes. Now, if someone may ask, how do you manage diabetes? You can manage diabetes by giving oral metformin. Metformin is a medication that helps to control blood sugar. You can equally manage diabetes by regular insulin checkup. You can equally manage diabetes by giving regular insulin injections. Even quite apart from that, we have some foods that you can take that will help you to manage diabetes, like citrus fruits, example like orange, lemon, and grapefruits, apples, avocados, protein like lean meat, example like chicken, turkey, and the rest. The legumes, you can take legumes, and you can equally take low-fat dairy products. The low-fat dairy products are cheese, yogurt, and milk. This is how to manage diabetes. We have some complications of diabetes. You can have DKA. DKA is diabetic ketoacidosis. This is accumulation of ketones in urine, accumulation of ketones in blood. That is ketonuria and ketonemia as a result of diabetes mellitus. If diabetes mellitus remain untreated, the body is going to resort to non-carbohydrate source of getting glucose. The body will now begin to do lipolysis, that is breakdown of fats. So if the body breaks down fats to synthesize carbohydrates or glucose out of these fats, this is what we call gluconeogenesis. Gluconeogenesis. And this end products of the fats is what we call ketones. And this ketones is going to be accumulated in the blood is equally going to be accumulated in the urine. That is ketonuria and ketonemia as a complication of diabetes mellitus. Thank you.